All right, so I'm going to show you how to inject the insulin into feta. So in this syringe here, I just have some saline to start because we're not going to start the insulin right away, but it's just just for the demo today. So these are the syringes. They're very similar to what you'll be using. They just have a different cap, but these are essentially the syringes you'll be using. And feta will be getting 2 units twice a day. So if you see these little syringes, every little line is 1 unit, so it's not very much. So she is getting, if you see up here, is at the second little line. So she'll be getting 2 units, okay? I've already drawn it up, but this is the bottle it comes in. And what you just do is before you take it out with a syringe, you just want to gently roll it in your hands a couple times just to make sure nothing is in there, it's all settled out. And then you don't have to do anything, no cap off. What you'll just do is you'll take your cap off of the syringe like this, and you will put the needle straight into the little rubber, the gray rubber here, and you just poke it in and then you draw it up that way. And then make sure to keep this in the fridge, and then you can set it down. And then in terms of the injection itself, you'll see on these little needles that there is a part, so this is the needle on one side, so it's just straight the same the whole way. And then if you turn it, there's a bit more of a flatter edge. It's called the beveled edge, if you can see that. And that's what you want to have facing up when you're injecting, okay? And then what you're gonna do is you're gonna grab a part of the skin. We usually do around the shoulder blade area. You'll wanna move it around a little bit each time, so it's not always in the exact same spot, but it's always gonna be around this area. So what you're gonna do is you're gonna take a piece of skin and lift it up and make it a tent. I use my index finger to just kind of make a mark of where I'm going to inject, so it's the base of the tent. And then with the needle with the bevel up, you're gonna poke just right underneath the finger. Make sure you don't poke yourself. You're gonna let go of the tent, and you're gonna pull back on the plunger a little bit to make sure that you don't get any blood. If you get blood, that's okay, just take the needle out. What you want to see is just air. So if you see air and no blood, which is what I'm seeing, then you're good to inject. So push on the plunger, inject it all, put your finger over it just to make sure nothing leaks out, give it a bit of a rub, and that's it.